Okay, good morning, everybody. Welcome to our little, we're doing a Zoominar about keeping optimal health during non-optimal circumstances. So I am here, my name's Leslie. I'm with Quality of Life Chiropractic. I'm a practice representative for both of our offices, the Magnolia location, 1488-2978, as well as Montgomery, 17099 Walden Road in Montgomery. I'm currently at our Montgomery location. What we're doing here today is I have Dr. Cheryl Winter, who is a functional medicine doctor, and she's also the author of Prescription Detox. And then I also have Dr. Gillam, who is our lead chiropractor here at Quality of Life Chiropractic in Montgomery, and she's actually in the office next door to me. So we're social distancing. But we're just going to talk real briefly about how of course, about holistic health and staying healthy, healthy during this time. Of course, obviously, our focus is chiropractic, and we here at our clinic, our big focus is we really teach wellness to folks. It's usually back pain and neck pain that attracts people to us to begin with, and then and that's no judgment. But what my job in particular is to educate people that. Not necessarily on the medical side, that's what the doctors do, but I go out and I preach chiropractic wellness on the streets. So I do lunch and learns, and I do screening events, and we help people set up their initial appointments, whether they're in pain or not. They'll come in and they'll get their exams, they'll get x-rays, they'll get the full consultation with the doctor and a complete report of findings. And we're doing that this month at both locations for only $20 for that initial assessment. And then once we begin, after we go through the report of findings, then they can start on their adjustments, and they'll have various recommendations for the treatments that they need depending on their particular conditions and so forth. Some people only have to come maybe once a month because if they're on wellness, that's ultimately our goal, is to get everyone to wellness. And then others may need to come a little more frequently in the beginning to get their problem corrected and get them stabilized, and then graduate them to wellness. And so, of course, our big effort is getting folks, you need to understand, just because the pain goes away doesn't need to be you quit coming, because you'll be right back in a few months and have to start all over again. So we don't want that. But I got another message. Okay. I don't know what the problem is there, but I'm going to have to address that when I'm not talking. But anyway, so yes, we are offering initial assessments, only $20 this whole month. We're giving a portion back to the Montgomery County Meals on Wheels. And then once you come into our clinic, we have a mission with our patients, not just to teach them wellness and to get that environment, but we like to be fun. We like to have a good positive environment, because we believe that it's not just the wellness of the body, but the mind. And we want to create that positive environment when people are in our clinic, and not some sort of stressy, icky. We have a lot of fun, as you've all seen. So, but of course, as why is chiropractic so important during this period of time is, yes, we are open. We are seeing patients. It's very important to keep your body at optimal wellness. And later after, in fact, Cheryl, Dr. Winter, wrote a book called Prescription Detox, which I had already mentioned. But there's actually an excerpt in that book that I want to read to you, and I just have to find it here. I thought I had it set up straight away, but I'll need to go in there and look. But she wrote a little bit regarding chiropractic in her book. So that's something that it's just a little short snippet, and I'll get on there and share it here later on during the meeting. But yes, so it's important that we maintain chiropractic, because chiropractic, it helps maintain the nervous system. It's basically, when your nervous system is in line and you have a lack of nerve interference, that's when your body performs at its very best. And of course, when your body's performing at its very best, you have a higher chance of staying healthy, staying particularly, I don't want to, let me say it carefully, protecting yourself against those nasty cooties that are out there, if you will. So So yes, we'd love to have you come see us. Not only that, it's not just about the wellness as far as staying strong and healthy, but our body mobility starts to decline when we're around 30 years old. By the time we're 50 years old, we actually have about half of the mobility we had when we were in our 20s. And then it drops even further after that. But with a good regular chiropractic program, and like I said, chiropractic wellness to us looks about maybe once a month. Some people maybe a little more. I tend to go quite a bit because I love it. But regular chiropractic care can help you maintain about 80 to 85% of the mobility you had when you're late 20s, well into your 70s and beyond. And that's with regular wear and tear. So if you want some strong optimal performance, that's where it starts. That's the root of it. It's the foundation of health. I mean, I lived for 20 years. I think everybody here knows that I served in the Air Force and I retired from the Air Force. But when I left, guess what? When you do that big old exam, we all do a big exam we got to do before you leave to determine disability and all that other stuff. Well, we found what had been bothering me all the time. I kept getting massages, but nothing seemed to work. Turns out I had degenerative arthritis in my neck. So that's not something, it's like, well, what's the solution for that? Well, you can't fix it. You'll just get some injections and over time. And I'm like, what the hell? No, I took my 2%, got me a chiropractor, and I'm still with them today. In fact, I wouldn't go away, so they decided they might as well pay me. But no, I've been a patient with Quality of Life for 8 years. We have been operating for 8 years. I've been a patient for 8 years and doing the outreach for almost 3. So I love our office. I love what we do. I love our leaders. I love our docs. They're all fantastic. And that's my story. So I'm going to, at this point in time, let Dr. Cheryl have a go, and I'm going to mute myself. Okie dokie. And then after Dr. Cheryl goes, we'll have a Q&A session. Okay, so Cheryl, go ahead and unmute yourself, and I'll mute myself.
Okay, if you can.
Cheryl?
Sorry, Leslie, can you enable this share screen? Do you hear me?
I hear you. I just don't know where to do that. This is
yeah. It says.
Oh, here it is. Share screen. Okay, here we go. Does that work?
Oh,
it only
says
shares
host
my
disabled.
Screen.
Yeah.
Oh,
yeah.
Great. I don't know how to fix that, y'all. I guess everybody can tell we're learning Zoom as we go. So I need to, let's see, find settings. Y'all, please excuse me for a minute. This is new. I've never enabled somebody else's screen but ours.
I've never seen that.
Here we go. Here we go. I think I got it.
Okay. So you cannot start screen share while the other participant is shared. So
I'm
you need to
stop mine.
Your screen.
Okay.
There we go.
Yay.
Okay. Yay. Uh-oh. Do you see my, what are you seeing? Let's see. Uh-oh. We're just having all kind of technical stuff today. I think I lost you. Can you see my screen?
There you go. There it is. I muted myself, but we can see it now.
Awesome. Okay. Well, thanks for inviting me. I appreciate it very much. And I hope everyone is doing well in this crazy time. So we've been hearing a lot about the COVID-19 and how dangerous it is. And yes, it is very dangerous. And I'm by no means going to want to make light of it. But the truth is, the shape of our immune system is going to be the determining factor of whether or not we survive this virus, should we get it. And you know, it's now being reported that by the time the COVID-19 pandemic runs its course, 40 to 70% of us will contact it. And, you know, this is not to scare anybody, but we know that, you know, 80% to 97% of the people who are getting the COVID-19 they have mild to moderate symptoms. And so we want to be in that group that does have the moderate symptoms or very little symptoms. So, our immune system is going to determine whether or not we succumb to any health condition, whether it be diabetes or high blood pressure, cancers, and even pneumonia and the respiratory distress that comes with COVID and influenza. So what we talk about today briefly is going to apply to coronavirus as well as other health conditions. But first, I need to make a disclaimer, and that is that this information is not intended to treat, diagnose, cure, or prevent any disease, and it's not intended to substitute from advice from a medical provider, and it's strictly for educational purposes only. So again, my name's Dr. Cheryl Winter, and I'm a functional medicine doctor of clinical nutrition and a family nurse practitioner. And since we don't have a lot of time, I'm not going to go over my credentials. I am qualified to talk about this topic. So please visit my website at drcherylwinter.com if you want to learn more about me. And I'm also, during this crisis, giving away an electronic copy of my book where you can learn more about proper nutrition and diet, especially now, because it's very, very important. And I also have a coronavirus survival protocol you can download free. So, we all know that we have to do hand washing and we have to do this physical distancing. I like to call it physical, not social, because we're still social, right? So, but my main message for you is that our terrain is everything. So you might remember the theory made popular by Louis Pasteur, which was the germ theory. But the truth is, it's not about the germ. Claude Bernard, he had it right. He said that it was the terrain that was everything, but everyone ignored him. But the terrain is everything, and that's been proven. So we have to clean our tank or our body, let's say, to increase our survival. So you could vaccinate a fish that's in a dirty tank, but it's not going to make any difference if that tank is dirty. So please remember that people that have pre-existing conditions like diabetes and high blood pressure, they basically have terrain problems. So it's important that they be concentrating on improving their condition, and it is reversible. So I just want to make that point that diabetes and most chronic health conditions are reversible. So I want people to know that this disease is not inevitable if we should get it. It is irreversible, and it's not beyond hope. So it's in our control whether or not illness happens, as Leslie pointed out as well. So the media makes it appear that we are all victims, but this is just not true. So surviving COVID or any health condition is all about strengthening our immune system and keeping us out of the ditch and on the defense. So most people don't know how close they really are to falling into that ditch. So let me explain. Here is a beautiful meadow, except for one thing, and that is the ditch. So think of this beautiful meadow as your biological landscape, your body. And so when you are out of the ditch, you feel great, but when you're in the ditch, you're not feeling so good. So your goal is to stay out of the ditch, right? So if you're pretty close to the edge of that ditch, though, with the same decline in function, you're going to get into the ditch. And if you stay far away from the ditch and you suddenly have a decline in your health, you won't fall in necessarily. So my goal is to move you as far away from the ditch as possible. And here is how we are going to do that. So I don't have time to go over all 6 of these because, you know, we have a short amount of time, but I'll go over a few of these, and please interrupt me again, as I said, if I'm going over on time, Leslie. Okay. So the very first one is that we have to secure our border. So what exactly does that mean? Well, did you know that most of our immune system is, that's about 80% of it lives in our gut lining. And it lives there because that's where the majority of the threats come into the territory. And not only that, but when we are digesting our foods, the way in which we digest our food plays a real role, big role in how our immune system feels. It's crucial that we have proper digestion, and digestion starts in the stomach, where our stomach, the stomach acid is going to kill these threats, such as viruses, before it gets absorbed into the small intestines. So it's really important that you optimize your stomach acid, meaning you don't want to be taking antacids, for example. We know that some of the most serious complications of this virus is respiratory distress. And we know that 50%, there's a 50% higher risk of pneumonia in people who take PPIs, proton pump inhibitors, or antacids. And so how do we prevent that is by making sure we have the right diet. The sad American diet tends to lead to us wanting to take these antacids. All right, so we got to work on our diet. In addition, before I move on from the gastrointestinal system, is we have to have healthy tenants. What does that mean? You know, most of our body in our gut are made up of bacteria, good and bad, and we want a majority of the good bacteria. And so that might mean eating fermented foods or taking probiotics so that we ensure the good bacteria in our gut. Now, before I move on from the gut, I just want to make note that we are now finding out that there are gastrointestinal issues with such as diarrhea that can present with the coronavirus. Unfortunately, it's also been assessed that those with digestive issues, their chances of recovery are significantly less. So it's very important that we take care of our guts and improve our digestion. So I'm now able to order testing kits that can test for COVID-19 in our stool, as well as antibodies in our blood. So if anyone wants more information, they can contact me about that. All right, so the second thing we need to do is build a strong and intelligent immune system, is to give it the right nutrients and the right fuel. So we need to feed it by eating a lot of plant foods that have a lot of nutrients. You also want to have good, healthy fats, because we know that research shows us that these healthy fats are going to improve the T cell activity against influenza and other viruses. So the T cells are just a type of immune cell that is going to fight against the bacteria. And the antioxidants that are in these foods are going to help put out the fire, meaning the inflammation that's occurring as a result of the virus and as a result of our immune system trying to attack it. So it's also important that we purchase organic, because sadly our foods are full of pesticides, especially glyphosate, and it's being sprayed on our food and it's causing inflammation, and it interferes with the production of the major antioxidant, which is glutathione. And this can cause damage to our DNA. So we need to put out the fire by making sure we have the right antioxidants and not flaming that fire with things like pesticides. So I want to talk briefly about important nutrients. I'm going to go through this quickly. But vitamin A, very, very, very important. we know that children with measles, when they had a deficiency of vitamin A and they were given vitamin A, they recovered from this, and it's better than any drug. Vitamin D, also extremely important. And so we don't get a lot of vitamin D from the foods that we eat, sadly. So we got to get outside in the sun without sunscreen. So if we don't do that, we're going to need at least 10,000 international units a day, especially during the winter months, until we get our levels up. And many people are having low levels. I find that in my practice. Another very important one is zinc. So we know that the chloroquine medication that they're starting to use to fight off this virus, what it does, it's a zinc ionophore. So it helps zinc get into the cells. So that is very, very crucial. So we're glad to know that there's some kind of medication that can help as well. Selenium, also extremely important nutrient. We can get this strictly by eating 2 Brazil nuts a day. So I do want to make note, though, that, you know, because our digestion sometimes is off and our absorption is sometimes off, we have to test. Maybe we're eating a good diet, or we think we are, but we're not absorbing it. So we need to test these micronutrients. And I do have that test available should anyone want to do that. Helping our immunity stay strong also includes getting sunshine, as I said, but especially we need to get our sleep, at least 8 hours a day. We know that less than 6 hours increases our risk for viral infections by 350%. So very crucial. And the last thing I want to mention is about our strategic alliances, and that's we need our hormonal balance, because our organs are talking to each other. And the way they do that is through our hormones. And we're finding out now also that this is coming out of Wuhan, China, that those women who took estrogen have a better chance of survival against the virus than those who didn't. And also they found out that men taking testosterone also had an improved risk, a decreased risk. So I know we don't have much time, so I could go on, but I'm going to stop here so that you, Dr. Gillam, can talk.
Okay.
I'll stop sharing, and I can always share again if you need to.
Yeah, Dr. Gillam, just real quick, if you will tell us your story real fast, and then because we've got less than 10 minutes before Zoom times us out, I wanted you, if you could just tell us your story real quick, and then I'll open the floor for questions from the ladies, and I'm going to let Lady Cat go first. Since Cat, you work with us, but I'm going to let Lady Cat go first with questions. Okay. All right, Dr. Gillam, hit it.
Hi, I'm Dr. Gillam with Quality of Life Chiropractic. I just want to echo, of course, what these ladies have said. Sunshine, very important. I know a lot of people are staying in their houses right now and they think they have to stay actually inside. Go out in the backyard, you know, just lay out, get some sun, because it is really important for your health to get that vitamin D. Also, just taking your supplements, making sure that that vitamin C, vitamin D is high right now, and then getting regular chiropractic care, because we know that the nervous system controls our whole body, and when we have interference there, then we're going to be less mobile. We're going to get sick more often. So just keeping that spine aligned and healthy, making sure that you have your best chance, especially right now, is very important. So I want to encourage everybody to stay active, stay mobile, drink plenty of water, get plenty of sunshine, just, you know, stay healthy, and say, you know, positive thoughts as well, because a lot of people are getting really down. They're listening to the media and it really dampens their happiness. And I want everybody to feel happy, because it's important to keep your spirits up right now. So think positive thoughts, drink chiropractic care, stay healthy. We'll all get through this together.
Get adjusted.
Yes.
And take your estrogen. I've been taking my stuff. Okay. All right. I'm opening the floor for question and answers. So ladies, fire away. Any questions?
Question.
Yes, ma'am.
what are some of the foods that you would find in estrogen, or what are the foods that you would find in estrogen?
Okay, so
Estrogen.
estrogen is not found in foods, but basically we can improve our estrogen balance by eating cruciferous vegetables like cabbage and broccoli. And so that's the best way that we can improve our estrogen and the other thing is we have to stay regular. We have to have regular bowel movements, and because estrogen will recycle and stay in our system if we don't get the excess metabolites out, and that's what can cause people to become, like PMS symptoms if too much estrogen is retained. So we got to get it out by eating lots of good fiber. We can do flax seeds and chia seeds to help regular bowel movements, and just increasing our vegetable intake, especially of those cruciferous vegetables. Good question.
Thank you.
Mhm. I want to read that excerpt out of your book, Doc, but I don't want to take up the time, so it'll take me like a minute to get through it. So I'm going to, Kat, did you have any questions? I'm going to post a picture of it in the event. Do what?
I'm just here more for support and just being part of the team. I didn't really have any questions, although thank you, Dr. Winter, for coming, because I know my family's got a leaky gut issue, and it's really crazy how it's almost like also like chiropractic care and leaky gut is things like we should have grown up to know, but we have to be taught as adults.
That's very true. We've learned a lot over the years, so I've learned a lot too over the years. So
Right.
Science has changed.
Yeah, and adults are the most stubborn learners, right? Yeah, I would rather invest in what I can do now than have to pay the price later. And,
For sure. You're going to pay one way or the other, right?
Right. Well, and like, keeping our immune system strong, of course, making sure our hormones are optimized, making sure we're getting adjusted, making sure we're not eating an unhealthy diet loaded with a bunch of sugar and processed crap. But not only that, monitoring alcohol intake. I know right now that a lot of people are really stressed and boozing it up. And I ain't gonna lie, I enjoy my champagne just like anybody. Look at Lady Cat's face.
Yeah.
But the truth of the matter is too much alcohol can really lower your immune system. And if you're waking up feeling a banging head every morning and dehydrated and stuff, you might want to re-examine how what you're putting in your glass.
Yeah, we have to remember that our bodies are going to heal itself, right, Dr. Gillam?
Right.
But we have to give it what it needs and take away what it doesn't need, and it doesn't need alcohol. That's inflammatory.
Yeah. I love my alcohol just like anybody else. I've gotten to where I have a trick I used is because over the weekends it's so easy, especially since we can't go anywhere. It's so easy to get caught up in day drinking. So I wanted to enjoy some champagne this weekend. So what I did was I made myself wait until 9 p.m. And and I was like, oh, I drank a lot less.
Or go out for a walk until that craving is gone,
Right. Right, because I'm not going to say I'm going teetotaling because everybody knows I ain't going to do that. But but you don't have to,
moderation.
I know in my previous lifestyle before I lost weight and everything, I was guzzling probably, those big size bottles of wine. I was probably hitting 3 or 4 of those a week. And that's equivalent to a bottle of wine a day, which is really, I know there's more, but that's quite a bit. But yeah, trying to, not saying you have to deprive yourself completely, but put a limit on it and don't overindulge. Not only that, but it makes you look old too after a while.
For sure. For sure.
Ladies, I actually need to sneak away. I have a patient here.
Yes, okay.
But thank you for all the great information, Dr. Winters. Thank you for being on the call with us. I enjoyed it.
Pleasure.
Thanks for being here, Dr. Gillam. We got 1 minute and 10 seconds left before we time out, but thanks for joining us, Dr. Gillam. And I'll get this reviewed and posted. Got to make sure we don't have any bleeping moments.
There you go.
But thanks for your patience also while I figure out how to operate Zoom. Every time I do one, I get better at it and better at it, but I'm still
There you
like
go.
a neophyte at it. So, but I'm hoping I can show the girls on our team a little ways, we can do it. So everybody stay tuned. I'm going to be posting another event at some point soon, talking about how I can do virtual posture screenings. So that's coming up soon. So y'all stay tuned. Hopefully by the end of the day tomorrow, my Lord. But if unless anybody else has anything to go, I'm going to go ahead and conclude the meeting because we're less than a minute. Thank you everybody for taking the time to be here. Thanks, Lady Cat. Thanks, Cat, for your support. Thanks, Dr. Gillam, for being here. And definitely thank you, Dr. Winter. We appreciate you. And look up Dr. Winter on Facebook, Dr. Cheryl Winter, Vital Health Solutions. Look up Prescription Detox. And then, of course, we have 2 Facebook pages, Quality